everyone, welcome to today's topic. Our topic today, we are going to talk about breast cancer. What is breast cancer? Types of breast cancer, causes of breast cancer, the signs and symptoms, investigation, treatment, and prevention. Before we start, ensure you watch this video to the end so that you will know everything about breast cancer. And don't forget to subscribe to our channel, share, like, drop your comments. If you have questions, you can also drop your question. We are going to answer you. Thank you and stay tuned. Okay, what is breast cancer? Breast cancer is when the breast cells changes in nature and become cancerous cells which multiply and form tumor. So this breast cancer, women are mostly affected. Men are also affected by breast cancer, but women has a greater percentage of it. In this case, about 80% of breast cancer cases are invasive. Invasive meaning that the breast cancer can spread from breast area to other part of the body like lungs, brain, and any other part of the body. It can spread to that 80% of it. So what are the types of breast cancer? The most common types of breast cancer include the following. One is invasive or ductal carcinoma. This type of cancer starts from the milk duct and spread to nearby breast tissues. The number two is the lobar carcinoma. This type of cancer starts from milk producing gland, which is the lobus, and spread to nearby breast tissues. The number three type is ductal carcinoma in situ. This type of cancer occur at the milk producing duct, but does not spread beyond the milk duct. Okay, so what are the signs and symptoms of breast cancer? Breast cancer may not cause noticeable symptoms, but when they do, the signs and symptoms include changes in the breast size, the shape, the contour, then mass or lump which may be felt when you're palpating your breast. We are going to talk about the breast self-examination in the next video. So when you're palpating the breast, you feel any mass or small lumps that feel like a small pear, is also a sign of breast cancer. And when there is a blood stain or clear fluid discharging from the nipple, all these things are signs of breast cancer etc. So when you watch the video, you also get the full details. Causes of breast cancer. Breast cancer occur as a result of when breast cells changes in nature and become cancerous cells which multiply and form tumors. So the following are the risk factor for breast cancer. Number one is aging. 55 years and above, one of the risk factors that can predispose someone to breast cancer. Number two is gender. Women are most likely to be affected by breast cancer than men. Another causes is use of tobacco use, that is smoking. Tobacco use has been as a research has shown that use of tobacco can dispose someone to have breast cancer. Intake of alcoholic beverages that contain alcoholic can also is also a risk factor for breast cancer. Another cause of breast cancer can be family history. For instance, if your parents, siblings, children, or close relative suffer from breast cancer, there must be likely that you also as can also suffer from breast cancer. Another one is genetic. The genetic, it means that you inherited it from your gene. It runs in your gene. So about 15% of cancer is genetics. So and mostly if those people it runs in their gene, they mostly suffer from BRCA1 or BRCA2, breast cancer 1 or breast cancer 2. Another point is radiation exposure. If you expose yourself to radiation like maybe radiation therapy, you have undergo anything, radiation therapy, it can also predispose you to breast cancer. Then another one is having obesity, excessive weight gain can also predispose you to have breast cancer. All these things mentions are causes of breast cancer. So what are the investigation you need to do for breast cancer? Number one is a physical self-examination like BSL, breast self-examination, which we are going to say in the next video. Physical breast self-examination, palpating your breast round to check for mass or lump. Then another one is use of MRI, magnetic resonance imagery, then breast biopsy. You can also do mammogram to check to detect if there is breast cancer, because even if you do not feel any lump or marks in your breast, mammogram can easily detect if someone has breast cancer, and early detection is very important so that the person can start treatment at the early stage. So another investigation you need to do immunohistochemistry investigation. All these things are the investigation to do just to know if you have breast cancer. So what are the treatments? Assuming that one have been detected of having breast cancer, depending on the types, the location, and the stage. So treatment depends on types and location or the stage. Treatments can be radiotherapy, it can be chemotherapy by the use of the infusion to suppress the cancerous cells. It can be surgery by removing of the affected parts or the affected breast, such as mastectomy, lumpectomy, removing the lump or removing the breast, or totally radical mastectomy, totally removal of the breast affected. All these things are the treatment depending on the stage or the types. Okay, so what are the prevention of breast cancer? In this question, can breast cancer be prevented? Breast cancer may not be able to be prevented, but you can reduce the risk factor for developing breast cancer. So what are the risk factors for developing breast cancer that you can reduce? Number one is regular. Ensure you do regular breast self-examination every month. Avoid intake of beverages that contain alcohol. Avoid smoking. Avoid the use of birth control pills, especially if you are above 35 years. Avoid the use of birth control pill to prevent pregnancy. It has benefit and also risk factors. So you can benefit it from preventing pregnancy, but you can also risk yourself from having breast cancer. So another point is breastfeeding. Exclusive breastfeeding can also help to reduce the risk of developing breast cancer. Even if you can breastfeed your baby from a year to 2 years, it also helps you to reduce the risk of developing breast cancer. Then another one is genetic screening. For those that have a breast cancer gene, it is very important that if you notice that your family has that gene, is run in your gene, is hereditary in your family, you have to do genetic screening to screen yourself, not when you start developing the signs and symptoms of cancer before you now know. It is very important you do screening at the earliest stage to detect it on earlier stage. So you are also encouraged to take healthy diet and then healthy weight. Ensure you maintain your weight and also eat healthy food rich in vitamins, protein, vegetables and fruits. All these things can reduce the risk of developing breast cancer. We've come to the end of today's topic. We'll talk about what is breast cancer, causes of breast cancer, types of breast cancer, the signs and symptoms, investigation, treatment, and prevention. You are encouraged to always do regular breast self checkup, even if you don't feel any, even if you don't see any sign or feel anything in your breast. You are encouraged to do breast self examination, which we are going to talk in our next video. Ensure you subscribe to this channel and turn on your notification bell so that you'll be the first person to see the next video.